in pursuit of health and wisdom. Sapio with Buck Joffrey.
Welcome to Sapio. This is Buck Joffrey. Now, I am going to do something a little bit different here today. I am going to stream a new podcast that I am doing in conjunction with a major podcast company, Acast, and some of the producers over at Imagine, Ron Howard's podcast company. And this podcast is called Longevity Junky. Junkie with a Y, by the way. It's slightly little misspelling there, sort of on purpose. Well, it was mostly because you couldn't get Longevity Junky, i.e., I couldn't get the words on for the website, so I went with Junkie with the Y. At any rate, this podcast is a little different from Sapio because in Sapio, as you might know, and I'm guessing if you listen and appreciate, it gets into the weeds sometimes. There's a lot of detail, and as much as I try to keep it so that everybody can understand it, I have been given comments by a number of people that it slightly goes over their head sometimes. And so that's not good for a mass audience. And what I really want to do is to provide some information for sort of, non-scientists, people who really would like to listen to an entertaining show and learn something, but don't necessarily need to get that crazy into the weeds. So that's what Longevity Junky is. Sapio isn't going away. However, Longevity Junky is coming in. And this show, I think you're going to find very entertaining. I'm able to get some fairly heavy lifters because of the connection with the podcast company. And so it makes it kind of interesting. I don't think that you will be bothered by it being too light at all. I think it is. It's still important to me to get some real science in there, but this provides for a lot more overall entertainment value as well. Nikki's really kind of fun, and she kind of keeps me lighthearted, and so it is absolutely a show that I think you should check out. And you might even consider making it part of your weekly listening schedule. Again, the show is called Longevity Junky with a Y. And now I'm going to play episode number 2 of Longevity Junky for you. It is with Dr. Daniel Amen. Now, do me a favor. If you like the show, go to Longevity Junky with a Y and subscribe to the show. And I would really appreciate a 5-star review because, again, it is hard to start new podcasts, and any gas we can get behind us will really, really help the show take off. So here's show number 2.
Longevity Junky is presented to you by our friends at Acast.
Hey, Longevity Junky, it's time to get your fix. I'm Buck Joffrey.
And I'm Nikki Leigh. And today we are in an amazing recording studio in Orange County for a very special show with a very special guest and someone near and dear to my heart, Dr. Daniel Amen. He is a hugely successful psychiatrist, brain disorder specialist who is using brain mapping in revolutionary ways. He has treated major stars and athletes. He is a multi-New York Times best-selling author, the chief and founder of Amen Clinics. He's also the founder of Change Your Brain Foundation, Brain MD, Amen University. I mean, I could go on, but I'm going to introduce my friend, Dr. Daniel Amen. Thank you so much for joining us.
So great to see you both. Thank you for having me.
Oh, it's our pleasure.
So I'll start out. I was just curious on, one of the things I was wondering about, because my background initially was in neurosurgery. And what struck me in reading your books and listening to you on some podcasts was that your approach to psychiatry and mental health is actually probably more similar to a surgeon than it is to your traditional psychiatrist. And I was wondering if you could tell us a little bit about that.
So when I was 18, I became an infantry medic. Vietnam was still going on. And that's where my love of medicine was born. But I realized a year later I didn't like being shot at. So I got trained as an X-ray technician and really developed a passion for medical imaging. As our professors used to say, how do you know unless you look? That becomes the theme of my life. In 1979, I got married, and 2 months later, my wife tried to kill herself. And I took her to see a wonderful psychiatrist. And I came to realize if he helped her, which he did, it wouldn't just help her, that it would help me. It would help our children, even our grandchildren, as they would be shaped by someone who was happier and more stable. So 45 years ago, I fell in love with psychiatry. I've loved it every day since. And I fell in love with the only medical specialty that never looks at the organ it treats. And I knew that was insane, right? You're a psychiatrist. You know how to diagnose insanity.
Well,
and so
and you're trained for it because you took the same board exams as the neurologist. You're already prepared for this.
Well, except in psychiatric residency, they don't really teach you about the brain. They teach you about the DSM, the Diagnostic and Statistical Manual, and I trained under DSM-3, so that was a long time ago. But it was symptom clusters equals diagnosis equals treatment without any biological data. So, and think of the insanity of this. You tell the doctor you're depressed. He gives you a diagnosis with the same name. You're depressed. And then he gives you an antidepressant, which in large-scale studies work no better than placebo, unless you're severely depressed. Or you go, I'm anxious, or I have panic attacks. And they'll go, oh, you have an anxiety disorder or panic disorder. And then they give you a medicine that's clearly addictive and hard to stop. Or you go, I can't concentrate. They go, oh, well, you have attention deficit disorder. And then they give you a stimulant. Or my favorite diagnosis to explain this idiocy is if you have temper problems and you explode intermittently, there's actually a diagnostic code, intermittent explosive disorder. What the hell does that mean? And then it's like, well, what do you do about it? And I'm like, no, this is insane. Cardiologists look, right? Neurosurgeons look. You would never operate unless you knew what you were going for, going to do. Why do they demean psychiatrists to almost a spiritual discipline instead of a medical discipline? And I'm like, I can't guess. Right? If you have dementia, I don't know, is your brain working too hard or not hard enough? If you want to kill yourself, well, why do you want to kill yourself? The result of a head injury? Is it a result of an infection? Is it because you had trauma? And the epiphany for me is when I started looking, everything in my life changed. Like everything in my whole life changed because I realized if I want to have a better life, I have to have a better brain. And most psychiatrists never talk about brain health. Your brain is an organ just like your heart is an organ. And I had Justin Bieber in my office, and we talked about this in his documentary Seasons. You know, Justin and so many of the celebrities I see, they come, they don't come, they do what you say, mostly not. And one day he came into my office. He said, I think I understand what you're trying to tell me. My brain is an organ like my heart is an organ. If you told me I had heart problems, I'd do everything you said. I'm going to start doing what you say. And then 8 months later, his brain's dramatically better. He actually slept in his hyperbaric oxygen chamber.
Oh my gosh.
Now, not something I generally recommend, but I love things like hyperbaric oxygen. And why am I, as a psychiatrist, love getting better blood flow to your brain? It's because you're going to be happier. You're going to sleep better.
Right. And this is where SPECT CT comes in, right?
Yeah, we did one. I wanted to ask real quick about like when you got the imaging of Justin Bieber's SPECT scan, was there anything specific in there that allowed you to pinpoint what was going on and you were able to treat it, or how did that exactly work?
Yeah, his brain was really hurt. Mm-hmm. And he had been diagnosed with bipolar disorder, and they put him on lithium. But when I saw his scan, I'm like, it's not bipolar disorder. His brain is hurt. You have to figure out why it's hurt. And it turned out he had Lyme disease and other infections. And
so was your scan the reason that they discovered that he had Lyme disease?
It's the reason they discovered we have to look deeper rather than to just give you a label.
Let me back up real quick just so people have an idea of what SPECT CT is and how you ultimately adopted that as sort of a major tool in what you're doing.
So we don't do SPECT CT, we do SPECT, which is a nuclear medicine study that looks at blood flow and activity. It looks at how the brain works. And I ordered my first scan in 1991. A nuclear medicine doctor came to our hospital. I was the head of a dual diagnosis unit at a psychiatric hospital. And he said, this is a tool to give psychiatrists more information. And so, given that it's a nuclear medicine study, we use very small doses of a radioactive isotope connected to a substance that's easily taken up by cells in the brain. And once we inject it, we can track it, and we actually get an image of living tissue. So it's really cool. And it basically tells us three things: good activity, too little, or too much. And then my job becomes balancing it.
Right.
Well, and we can show that with my scan as well.
So
right?
you did my show, Scan
Yes.
My Brain, I think 3 or 4 years ago.
Yes.
And so if we put up Nikki's scan, actually first, let's put up a healthy scan.
Okay.
So SPECT tells us three things: good activity, too little, or too much. And the image on the left shows the outside surface. The top left image, we're looking underneath the brain. The bottom right image, we're looking down from the top. And it should just be full, even, and symmetrical. The image on the right, the color does matter. Blue is average activity. Red is the top 15%. White is the top 8%. And it should be in the cerebellum, because the cerebellum is 10% of the brain's volume, but has half or more of the brain's neurons. And so we typically see the back bottom part of the brain be really active.
Okay.
And if you show Nikki's first scan, when I saw her 3 years ago, we look at the outside surface of her brain. It's stunningly beautiful.
That's
Just
hot.
like her.
It's hot, Nikki.
But when we look at her active scan, her cerebellum's healthy, but her emotional brain's lit up. Anterior cingulate, that's the spot at the top, basal ganglia. It's like those two eyes looking at you. The thalamus sort of looks like a mouth. You connect those dots, it looks like a diamond. And about 30 years ago, we went, that brain goes with emotional trauma. And then we published on that 3 separate times. And then I asked Nikki, I said, is that true? And initially you said no. And I'm like, are you sure? And as we've gotten to know each other over the years, it's absolutely true.
Yeah, absolutely true. Been working on that a lot.
Yeah.
Which is why I was like, we have to do a new scan.
And then you did ayahuasca and you told me how helpful it was.
Yeah.
And I'm like, well, let's do it again. And so we scanned you again earlier this year. Can you show me the next scan? And it's still busy. So in fact, it looks a little busier.
Yeah.
And so
I know it does.
You know, we never treat scans. We treat people. And so we use the scan. So the outside of your brain is still gorgeous. And when it comes to things like Alzheimer's disease, we can tell decades before you have any symptoms if you're headed to the dark place. And, you know, the blood flow to your brain is great, but it's too active to your emotional brain. And so I'm not the hugest fan of ayahuasca because some people have great experiences and some people have really, truly terrible experiences. And the ones who have terrible experiences are more likely to come.
Yeah.
That didn't work for me.
Right.
Yeah. But it's still busy.
Yeah.
When you look at scans, obviously you have got over years thousands and thousands of scans, and you've got various patterns. You just call this a diamond pattern, and it's almost like you were talking a little bit offline about how you can start looking at these patterns and feed them into artificial intelligence and kind of spit out those, almost like fingerprints, right?
Right.
For what that looks like. Is there, just out of curiosity, is there general differences between men and women on these tests?
So I published a study on 46,000 scans looking at gender, and we're not the same species.
I could have told you that.
Yeah, right.
And I actually argue, and I wrote a book called Unleash the Power of the Female Brain, that female brains are wired for leadership. They have much better frontal lobe function, much stronger, especially medial frontal lobe function. And the statistic that goes with this is who goes to jail, right? Whose behavior is so bad they have to put you in a cage? Males, 14 times more than females. But their emotional brain is much busier. And so that explains, I think, why they're at a significantly higher risk of depression.
So anatomically, that would be like the limbic system?
Be the limbic
right?
system.
If you'd talk a little bit about sort of, structural differences that maybe you see in men and women in that.
Well, structurally, the limbic system's larger in women. And that explains, because it's partly involved in mood, but also deeply involved in bonding and caretaking. And there's not one society on earth where men are primary caretakers for children. You sort of have to go down to penguins before you get that.
I thought maybe seahorses too. Is that
Seahorses as well.
Yeah.
Seahorses, that's so smart of you. They
my brain.
They
Thanks.
carry the babies. And my wife often says, if men raised children, we'd have a lot fewer of them.
Well, for lots of reasons, probably. But
So is there a SPECT scan that definitely shows this is a depressed brain and then, or this is a bipolar brain or things like that?
So
Is
one
there
of the big lessons I learned early on is depression's not one thing. ADD's not one thing. Bipolar disorder's not one thing. Now we have sort of the classic depressed pattern where emotional, I just published a study on this. Actually, it's a very fun story. 2005, 2020 came to my office and they were going to interview me on my work with childhood bipolar disorder, except they lied to me. They wanted to do a gotcha interview and shame me on national television. And they start the interview with Brad Peterson from Columbia. He's a child psychiatrist that does imaging. Says you should be arrested for your work.
why?
He said, the journalist said, well, what would you say about that? And in my head, I'm like, well, this is not what I thought. And when I was on the speech team in college, my professor said, if you don't know what to say, take a deep breath, smile, it'll come to you. And I looked at the journalist and I said, that's so interesting. Last week, someone told me I should win a Nobel Prize. This week, you're telling me I should be arrested. It sort of keeps me balanced. And at the end of the interview, the journalist took his microphone, threw it on the floor, looked at the producer and said, you lied to me. This guy's the real deal. Anyways, I got to meet Brad Peterson through the years, and we just published a big paper together on depression and showing the hotter someone's limbic system was, the more likely they were to get depressed.
We'll be right back after these messages. Welcome back to Longevity Junky. Now back to the show.
Yeah, I think about those differences in the limbic system that you described, and in your book, some of the things that you mentioned I thought were fascinating. For example, marital problems that you might not really even think about what's going on in somebody's brain may be the absolute reason for the marital trouble in the first place.
But marital therapists never look at the brain.
Correct.
Right? So you just assume the person's an asshole rather than maybe they had a head injury.
Right.
Or maybe certain parts of their brain work too hard. And I had this great case early on, like the first year I started imaging, I'm also a child psychiatrist. I was seeing these two kids, and I realized they're not getting better because their parents hate each other. And so I started seeing the parents in marital therapy. Well, And I started to hate the parents because like nothing I did worked, and I hate that, right? I hate being ineffective. And at 9 months of seeing these people, I'm completely ineffective. I'm in the shower getting ready to go to work, and I realize they're on my schedule, and my stomach starts to hurt. And I'm like, today I'm going to tell them to get divorced because it's not good for them or me. But I grew up Roman Catholic, and my mother was so serious about the whole thing. And, you know, getting divorced.
Like, I don't want to go to hell.
Very bad thing. And so the voice, right? Only Catholics understand. There's a Catholic voice in your head. It's planted there like a chip. It's like, you're going to tell these people to get divorced because you're not a good enough therapist, and damn their eternal souls to hell. And I just started looking at the water faucet, like, how much more therapy do I need? And I got out of the shower and called the person who owned the imaging center. And I said, would you give me 2 scans for the price of 1? And he's like, why? It's like, Jack, I have this couple and I just can't figure them out. He's like, couple? He said, I've been married twice. I can't figure it out. Maybe we could do a business and call it brainmatch.com.
Oh my
So I
God.
thought it was hysterical.
That is funny.
She had an obsessive brain. So her frontal lobes worked way too hard. That's what we see in OCD. And he had ADD. He had low activity in his frontal lobes. So he was constantly conflict-seeking, drama-driven, always sort of irritating her and late. And she had a PhD in grudge holding. And the night before, so if you believe in random chance, the night before I read an article in the American Journal of Psychiatry that Prozac calms down the anterior cingulate in this sort of hyperfrontal pattern. And I knew how to treat his ADD, so I put him on Ritalin, her on Prozac. I said, look, I don't want to see you guys for a month. I want to just let's let the medicine work. And they came back, and they were so good. Like, he had settled down. She wasn't so rigid. I mean, it's like, how do you do marital therapy if you actually don't know the biology of the people who are suffering?
Yeah. What about I'm curious, when we talked about men and women, what about transgender people? Like, is there patterns that you're seeing commonly? I mean, I'm sure you've seen, I don't know. There's not anything that clearly stands out.
Have you done imaging on transgender brains?
Yeah, I have hundreds of them.
But no fingerprints.
There's not anything yet.
Something that I really love that you offer to the public is finding out your brain type. I feel like that's a good place for people to start, just to kind of understand even how they think and everything. Can you give us a little bit more on that? I did it, by the way.
I did it.
You did it too?
You told me to, yeah.
Yes, that's
What are
true.
your
I'm
types?
glad he did it. Mine is, I'm number 1. It's it sounded so cocky right now. My brain type number 1 is B. It's balance.
Balance, right.
Yes, yes.
I was a 10, which said I was a mess.
Did it really? What does 10 say?
Eight's got everything.
Oh, it's got it. Okay.
So what I realized a long time ago is not everybody can get a scan. And so
Right.
based on thousands of scans, our database is now 250,000 scans, I developed a checklist to help predict what your scan might look like. And people go to brainhealthassessment.com. It's free. And then here are the strategies for this particular type.
What was your, what
Now,
is brain type
on
10? Talk
your
about brain type
scan.
10 versus 1.
On your scan, I would have predicted would be more like 3.
What is a 3?
3 is wanting things a certain way. So when they said you did the logo like 100 times,
Yeah.
that fits. It's like, no, I want it this way.
I just didn't get any options originally, and I was like, I need options. And then just so I didn't look back on it and be like, well, we could have looked at more. But yeah.
Do
okay.
1 in 10s get along?
Yeah, do 1 in 10s.
Yes, especially if you work toward getting them more balanced.
So you have to be more of like me.
No, it's you. You need to be more like me.
No, I'm balanced.
So we've got all these tools now to tell us, to enhance your diagnostic capability. was curious if you could tell us a little bit about where we've come in the understanding of this concept of neuroplasticity. Because when I was in medical school, and this, a few years ago, and we were taught that, that essentially that you're born with certain brain cells and you get your connections, and after you're a certain age, there's not going to be much change there. And obviously, that is not what we necessarily think today, and I'm sure you can comment to that.
No, I think it's the biggest revolution in neuroscience is you're not stuck with the brain you have. You can make it better. I can prove it. Now, neuroplasticity is really interesting because it's a double-edged sword, right? If you allow your brain to go to a dark place and you do it over and over again, your brain is plastic. You're going to mold it to negativity. Think of addictions. Your brain gets changed, and all of a sudden you're imprisoned to your addiction. But it can also change in a good way. It can change in a healthier way.
I think it's really how you talk to yourself.
It's a huge piece of it. But it's also what you eat, and it's how you sleep.
Agreed.
And it's not living in a mold-filled environment.
Yes.
Or if you get COVID, people go, why is there such this explosion of mental health problems? COVID is like an inflammatory bomb that goes off in the limbic system. And I have hundreds of COVID scans. And I have scans from before COVID. I didn't have COVID. Now I got COVID and I can't think. I have brain fog. It's like this explosion happened in the limbic system. And so how do psychiatrists do this based on symptom clusters without ever looking at what you're actually trying to treat?
So, I actually had COVID. I have what I call the OG COVID. It was before, the vaccines came out. So it was the big one. And it knocked me out for a month. And then I had what you're describing, I think, probably a lot of inflammation in my brain. I could barely make a sentence. And it was the strangest thing. And I felt like everything just slowed down in my brain. I'm curious, what were you seeing in those patients, those long COVID brain inflammation cases?
So early on, it's like this inflammatory bomb happens. So we looked at, what a healthy brain looks like. Then we looked at Nikki's brain. So think of Nikki's brain magnified.
In the emotional sense, the active
in the emotional
part,
centers. And then long COVID, if the person doesn't get help for it or their body doesn't help heal it, then you begin to see damage in the brain. And it was repeatable, and it was just very consistent.
You were talking about like environments and things like that can impact the health of the brain. Are there environmental factors that we are overlooking that can impact the health of our brain and what we should look out for or protect against or things like that?
So I think brain health is three things. Brain envy, got to care about it, right? It's the largest sex organ in the body. Think of it that way. Brain envy. Avoid things that hurt it, do things that help it. And I developed an acronym a long time ago called Bright Minds. You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. And that's what leads us to what are the bad habits, what are the good habits. So Bright Minds, B is for blood flow. Anything that decreases blood flow is bad for your brain. And this is where people hate me, because I'm like, caffeine constricts blood flow to the brain.
After my first scan with you, I literally changed everything. I mean, now I haven't drank in a year and a half.
Congratulations.
Thank you. And I love it. People think I'm nuts, but I love it. And I would literally go to this grocery store and get all the foods that are good for my brain, like avocados, walnuts, blueberries, like all these. There's like a whole list of them. And I just totally shaped my life into what would be good for my brain. Even thoughts, down to, positive
So that's
things.
the sign of intelligent life. When you realize your brain's involved in everything you do, how you think, how you feel, how you act, how you get along with other people. It's the organ of intelligence, character, and every decision you make. Well, oh my God, why would you ever hurt it unless you were stupid?
Yeah.
Right? I mean, it's like
Right.
when you get this information, it changes things if you attach to the information. And so nicotine constricts blood flow to the brain, and now we have this vaping epidemic. Marijuana decreases blood flow to the brain. I published a study on 1,000 marijuana users. Every area of their brain was lower in blood flow. If you're sedentary, if you have high blood pressure, if you have erectile dysfunction, because if you have blood flow problems anywhere, it means they're everywhere. And so that's B. R is retirement and aging. The older we get, the more serious we need to be. And are you having strategies that accelerate aging, like high iron levels? So many people don't even think about that. But if you have high iron levels, your brain's prematurely aging. If you have low iron levels, you're anxious and look like you have ADD and you don't sleep well and you have restless leg syndrome. The I is inflammation, major cause of mental health problems. And inflammation comes from infections, from fast food, from sugar, from having low omega-3 fatty acids in your body, and not taking care of your teeth. People who have gum disease is a major cause of heart disease, but also dementia. The G is genetics, and we don't think about genetics right. Genes load the gun, but it's our behavior that pulls the trigger. And so I want you to know your risk factors. Like I have heart disease and obesity in my family, but I don't have heart disease and I'm not overweight because every day of my life I'm on an obesity heart disease prevention program. I adopted my 2 nieces. I think I told you that. And because both their parents were drug addicts. And I'm like, you need to be on an addiction prevention program every day of your life. And when I caught the older one vaping, I grounded her for 6 months. I'm like, no.
Yeah.
I'm only doing this if you and I are aligned. And that's your risk, and you need to know it. The H is head trauma, major cause of psychiatric problems. And very few people know about it because psychiatrists don't look at the brain, so they don't know your intermittent explosive disorder is a result of the concussion.
So that's probably something a lot of parents are thinking about. We're nearing football season. What's your thoughts on that in terms of prevention of traumatic brain injury and kind of your experience with professional athletes? I know.
Yeah, golf is good.
I was an ice
Golf
hockey.
is good.
Tennis is terrific. Table tennis is the world's best sport.
Yeah.
When I was at
Pickleball has taken over the world.
pickleball, is awesome. When I was at the Olympics, I went to the table tennis match, and it was amazing, their reflexes and how fun that is. No. If you love your children. Now, if you don't like them.
If you don't love your children.
If you don't love your children.
Let them go for Pop Warner football.
But why would you put them in a sport? And I loved football, right? I played football. I've been a crazy Los Angeles Ram fan my whole life since I was a little kid. Until I started scanning NFL brains, and almost all of them are terrible.
Yeah.
Right? Your brain is soft, right? You know this more
Yep.
than me. But like the consistency of soft butter, your skull is really hard and has sharp, bony ridges. Helmets don't protect you from brain damage. They protect you from skull fractures. And no. And rugby, bad. Hockey, not great.
Okay, well, look at me. I was an ice hockey player.
You're an ice hockey player. They can fight.
Putting your
A
kids
lot.
on big animals like horses, not a good idea. Because, what killed Superman? Christopher Reeves. It was a horse.
Right.
We have to be more thoughtful, more protective. And people go, Dr. Amen, you're just no fun. And I'm like, no, I'm a lot of fun. And you have a lot more fun if your brain works right.
Yeah.
That's true.
We have a course called Brain Thrive by 25 for high school and college students. And invariably, when we do the week on things to avoid if you want to have a healthy brain, a 14-year-old boy, never a girl, always a boy, goes, how can you have any fun? And we play a game with them called Who Has More Fun? The kid with the good brain or the kid with the bad brain, right? Who gets the girl and gets to keep her because he doesn't act like an idiot? The kid with the good brain or the
Right.
kid with the bad brain, right? Who gets into the college they want to get into, who has the best job, who makes the most money, who drives the coolest person with the good brain.
That'll get any little kid.
One of the things that Nikki and I have been focusing on is, trying to get information to people about some of the big killers, because we're all about longevity. Obviously, Alzheimer's disease is a big one that people are afraid of. And specifically, you brought up something interesting I would love for you to expand on, because as I'm looking at the literature in Alzheimer's, we're seeing more and more of a switch from this idea that the cause is this beta amyloid plaques or these aggregates of protein, and more that those might actually be sort of the fallout of something that is actually more related to blood flow and potentially blood glucose metabolism as well. Would love to get your thoughts on that and what you're seeing with Alzheimer's.
So this Bright Minds acronym, it's my Alzheimer's prevention program. And I think the beta amyloid theory of Alzheimer's disease is dying because it's not right. That's a reaction. There are a lot of people who have high beta amyloid loads that don't have Alzheimer's disease. And so when the theory doesn't completely fit, it's probably not quite right. And Alzheimer's is often called type 3 diabetes because it's the D in Bright Minds is diabesity, where you're overweight and or have high blood sugar levels. As blood sugar levels go up, blood vessels become brittle and start to break and lower blood flow to the brain. I think infectious disease. So the second I in Bright Minds is immunity and infections. There was a piece in the Journal of Alzheimer's Disease written by 33 scientists on infectious disease as a major cause of Alzheimer's disease that no one's talking about, like herpes and Lyme disease and Epstein-Barr and toxoplasmosis, which is such an interesting illness. You get it from cats.
I actually had that at birth.
You had toxoplasmosis?
I had toxoplasmosis, and it ate away part of my left retina, so I have no field of vision in my upper left quadrant. And I discovered this randomly at an ophthalmologist's office when I was a teenager.
Wow.
I was lucky he didn't eat my whole brain, luckily, but that's
Yeah. And then so getting that treated becomes absolutely essential. But if you wouldn't have, then dementia and all the pre-problems that go in from having a brain that's deteriorating would have been part of your life. And so many people, they come to us for depression or temper problems or whatever, and I look at their brain and I'm like, something's going on. And we hunt down, find it's toxoplasmosis or cytomegalovirus, COVID. Getting that treated is so important.
And if you get it treated or caught in time, does that allow Alzheimer's to, I don't know, not necessarily be cured?
Yes, that you can prevent it.
Super preventative.
Right? You want to go after all the preventable causes and all of the treatable causes.
So you mentioned that you could see it decades ahead of time. Is that, I guess, what you were talking about earlier, maybe like early signs of less cerebellar blood flow?
The pattern for Alzheimer's disease, if you put your thumbs in your ears and your hands on your head, that's the pattern for Alzheimer's disease. It's bilateral, parietal, top back part of your brain. That's why people get lost, because it's involved in direction sense. And temporal lobe, where memory is, hypoperfusion, which means just low blood flow. And we're diagnosing Alzheimer's later than ever before. Why? The iPhone. Because you just have to So before, you get lost going home in the city you've lived in for 32 years.
Yeah.
But now all you have to do is go, Siri,
GPS
take
it.
me home.
Yeah. Wow.
And so we're actually diagnosing it later. And family members are often in denial. It's like he's asked you the same question 6 times.
Right.
And he doesn't know what he had for dinner. I had one guy tell me he would hit a golf ball and like
Can't find it.
the next minute he wouldn't know where the ball went. Wow. He's like, I think I have a problem.
Well, once that starts, are you able to take something or do anything to, I don't know, dial it back?
Well, the sooner you do it, the better, right? I mean, if you get it early, way better than if you get it late, probably not much.
Right.
So there was a study that, I'd been reading about. It was kind of interesting a while back that was showing that men who were taking Viagra, so it's, obviously increasing blood flow for other purposes, were actually less likely to be diagnosed with Alzheimer's disease. You want to talk about that, and if that is maybe a reason to consider, taking low-dose Cialis for men other than erectile dysfunction?
Well, I think the important thing is get your brain scan so you know how the blood flow in your brain is. If it's fine, you're probably not a reason to take it. If you have erectile dysfunction, if you have blood flow problems anywhere, it means they're everywhere.
Right.
And so probably taking Viagra or something like that on a more regular basis, good for your love life, good for your brain.
Yeah. And for men, your brain is often associated with...
Okay,
it is the largest sex organ, right? I often say no forethought, no foreplay.
No foreplay. I love that. I'm going to circle back because you dropped a little bomb that you said that you were at the Olympics, and I want to know why were you there?
Well, I got invited to be on the coaching staff of Alicia Newman, who is the Canadian record holder in pole vaulting.
As of the Olympics?
No, she's been the Canadian record holder for a number of years. I think the last 7 years. She was in the Rio Olympics, but didn't do very well. She was in the Tokyo Olympics and didn't make one bar because that was in July. And April, she fell in a bathtub and had a severe concussion and developed something called Irlen syndrome, which is light sensitivity. And if you're in the stadium under those lights, she said she just couldn't see. And then she DM'd me on Instagram, and I saw her. She did my show, and I'm like, this girl needs me. She had a lot of ANTs, automatic negative thoughts, and we repaired her brain and then got her mind to be incredibly strong. I'm so proud of her. And so I was there, and she qualified for the finals, and she got the bronze medal. And it was so cool.
Good for her.
Yeah.
Congratulations.
And so using all these bright mind strategies, it's not only to prevent Alzheimer's disease or treat depression, it's to be elite. And that's what I love. I want this next sort of phase of my career to really help people be their best, right? And if you're struggling with ADD or anxiety or depression, I mean, of course you got to deal with that. But I want to know, what do you want? So she wanted to be an Olympic medalist. Okay, what are we going to do to get that? And the first thing you got to do is like have a better brain. And so she stopped drinking. And I've found right before, because I'm really interested in diet, right before she would do her tournament, on the way over, she'd have dry mangoes, which is just nothing but pure sugar. And I'm like, no. So we switched it to apples and almond butter. And she wore a continuous glucose monitor, and she knew the foods that spiked her blood sugar and foods that kept her stable. And if your blood sugar is more stable, guess what? You're emotionally more stable.
Yeah.
Absolutely.
So when you're at the Olympics, what are you doing on her team exactly? Like there she's...
Well, screaming like crazy. The night before the qualifiers. And that was actually the most important because she had never qualified for a finals, even though she was there in Rio and in Tokyo. So we spent an hour and a half, and she and I did a lot of EMDR. So you and I have talked about EMDR. It's eye movement desensitization and reprocessing. It's a psychological treatment for trauma. And there was a lot of trauma when you're an elite athlete and you fail. It's a trauma experience for you, for sure. And she had a very public domestic violence thing with her ex-boyfriend, who was an NFL player, so you can imagine his brain, right? So that was very traumatic. She had terrible coaches. That was traumatic. She broke her back when she was 12. That was traumatic. And she was mean to herself. So we got her to be kind to herself, worked on, called our game day dopamine, right? It's drip dopamine, don't dump it. Too many, especially when you're famous, it just wears out the pleasure centers in your brain. So we built those back up.
What were some drip dopamine techniques?
So, good sleep the night before. Sunshine. First thing in the morning. Go outside and get sunshine. We had a very strategic use of caffeine. Like, I'm not a huge fan, but she found right at the beginning of the tournament, if she had just a little bit, it would sustain her. That means she never had it in the morning, didn't have it on any other day, just used it very strategically for that. We had a whole supplement regimen. Pumpkin seeds, of all things. Pumpkin seeds increase dopamine. Magnesium increases dopamine. So we had our game day dopamine. And she watched herself. So I had her make a highlight reel of her best jumps. And she watched it every night because I wanted to plant in her subconscious mind, I do this perfectly.
Yeah, have that like
right, because if you see yourself
in your
failing,
head. Right.
You're just,
over and over,
you're just
that's
more
what
likely to fail.
Exactly. That's all you can see.
That's what you see.
Yeah.
That's what you're training.
Right. Oh, that's great to do a highlight.
When you mentioned broken back, it reminded me of my own back problems, and it got me thinking about pain. And I know you're actually writing a book right now about pain. And what do you think what are some of the things we don't understand about pain that I think that you'll be writing about?
That it's processed in the brain. That both physical pain and emotional pain are processed in the brain. And the reason I'm writing the book is I started to ask this question: why do certain antidepressants, like Cymbalta, or certain anti-epileptic drugs, like Lyrica or Neurontin, why do they decrease physical pain? And I'm like, oh, they're both processed in the brain. And there's three pathways. There's the lateral feeling pathway, right? The thalamus, that's sort of the sensory gateway in the brain. The parietal lobes, they activate when you feel it, right? So if your thalamus, because you're depressed, is already busy, pain is going to be magnified. The most interesting is called the medial pain suffering pathway. And that's the limbic structures and the anterior cingulate gyrus. That what are all those things that fire that up? And pain fires it up. But then you start catastrophizing, which then fires it up more.
I think you call it the doom loop.
And it puts you into the doom loop. And so I teach people in the book, that's sort of the major theme of the book, is the doom loop and the healing loop. And there's 6 steps in the doom loop and 6 steps in the healing loop. But then there's the also fascinating descending pain inhibitory pathway, which is your prefrontal cortex. Because if that's offline, you can't inhibit pain. And so it's really an exercise on how to get your brain super healthy to go and manage physical and emotional pain, because they just go together so often. And I'm super excited.
So is there a way out of the doom loop?
So the way out of the doom loop is what I call the healing loop. And so still pain for any reason, and you want to understand it. And then calm the medial suffering pain pathway. And you can calm it with things like diaphragmatic breathing, with meditation, by getting all of the Bright Minds risk factors healthy, right? The healthier your brain is, the less inflammation to that doom loop. And then do the opposite of catastrophizing, but that's where I teach people to kill the ants, the automatic negative thoughts that steal your happiness. So really starting to discipline your mind. We add in positivity bias training rather than let your brain go to, I'll never walk again, I'll never be able to play with my grandchildren again, right? Train your brain to do what's right. And then very specific progressive muscle relaxation exercises. But there, I also talk about repressed rage, and you need strategies to get the rage out. So it's sort of like Pollyanna meets Hannibal Lecter. And it's like being able to express what you really feel, but also being able to quickly get back to a positive place. And then good brain habits will help, and it'll lead to a cycle that just helps you heal.
Why in the world would we have evolved to have some kind of a doom loop?
Well, negativity evolved to keep us alive, because if you didn't wake up anxious that something was going to eat you, you got eaten, and so you didn't survive. Those genes didn't survive. The problem is it's outdated now, because we don't have large animals who are trying to have us for lunch. So that part is not good.
Yeah, our life has completely changed. We have iPhones now.
We have iPhones.
That send us to.
And our brain did
us.
not evolve to manage the dopamine dumping.
Right.
From,
There's no dripping dopamine.
There's no dripping
with an
dopamine.
iPhone
You have to
or
be
an
very
Android.
careful with your phone. So the doom
Right.
loop starts with pain for any reason. And the second part of it is it activates the medial suffering part of your brain. And then you start catastrophizing, and then your muscles get tense and you hurt more. So you engage in bad habits. And a lot of people don't know opiates. They help short term, but they piss off your white blood cells, and they actually make pain worse.
Right. And what about endogenous opiates? So when we were talking about the placebo effect, we know that there are various chemicals that are similar to opioids that you'd be taking that are actually released by our brain. How does this all fit into kind of...
Well, the periaqueductal gray area produces endorphins. And so that's it's part of the descending inhibitory pathway. Those are the strategies. How do I get that? How to get my frontal lobes up and that area to pump out more endorphins. And so one of the things I had Alicia do the night before, because she was having trouble sleeping, is I said, I want you to watch Kevin Hart. Because when you laugh, it increases endorphin production.
That's a great idea.
Oh, that is great. Go to bed.
And
with
actually,
calm.
gets your parasympathetic system going too, right? Good for sleep. I know people who use
Along
it for
with
sleep.
diaphragmatic breathing. Remember, you and I actually did a video together.
I did breath work this morning.
Did breath work where you're breathing with your belly.
Yeah.
Where especially pretty women, they're always holding their bellies in. It's like, don't wear tight clothes. Don't.
Not
hold
me.
it
I'm
in.
never holding my belly in.
No, yeah,
you guys
breathing
have,
is huge.
You guys have different challenges.
This is true. This is true. So funny.
Okay. Fine.
Well, I mean, I could seriously, we could probably talk to you for absolutely forever. But all of this has even got me anxious to want to get a new brain scan. I feel like every day I'd want to do one. So I'm sure there's a bunch of people listening that would love to know how they can get their brain scan, unless it's just for celebrities, because that's what it's No.
No.
Exactly.
We have 11 clinics.
Well, there
we
you
have
go.
about 10,000 patient visits a month. We see little kids. We see old people. We don't see many celebrities. We just have fun
just
with
promote
them.
those. Yeah.
That helps us increase awareness, right? Our mission
Yeah.
is to end the concept of mental illness by creating a revolution in brain health. So if you want a better brain and you want a better mind and you want a better body, go to amenclinics.com, learn about our work, follow me on Instagram or TikTok.
Yes. I know.
Fantastic.
I love your videos. They're always so educational, but then also fun. So thanks for that.
Thanks, Dr. Amen.
Thank you. Thank you for helping me share this.
Oh my
I'm
gosh.
so grateful.
It is so our pleasure. We're going to take a quick break and we'll be right back with our healthy takeout. Welcome back to Longevity Junky, and it is time for our healthy takeout.
What a great interview, right?
I love
He's
Dr.
great.
Daniel Amen.
So what were your takeouts? Because there's probably a lot of takeouts here, but I want to hear your.
There is a lot, and I have, kind of done an interview with him before, and have been studying and following him for years. But one of my biggest things was the dopamine drip. We have our cell phones and our watches and all these things now that just flood us with all this dopamine. And I loved how he used the dopamine drip for athletes, like these elite athletes. And that also reminds me to, lessen the phone time or do things incrementally that bring me happiness and just allow it to be just like drawn out as opposed to just a flood of it. It doesn't serve us, right?
No, definitely not.
Yeah. What about you?
Well, I always try to put things in frameworks, and like sort of the frameworks that we've been talking about, it's sort of the things that drive longevity, and if you look at, we talk about diet. So he obviously talked about diet. We've talked about the need for control of blood sugar, huge. Supplements, I think that I think a lot of people should consider. Obviously, we're not here to give medical advice, but fish oil.
Yes, he said that. For sure.
Very good control of your vitamin D levels, vitamin D3, which is
also
a big
goes
one.
with the sun,
Yep.
which he said very important to get the sun exposure right in the morning as early as you can.
We always talk about exercise, and you mentioned it again. He mentioned racket sports, and I think he's mentioned this on multiple occasions that hand-eye coordination sports generally tend to be sports that are associated with longevity because they actually use your entire brain as opposed to just pounding away on some ball, right? So like if you're actually using different parts of your brain and it is, it's required to kind of coordinate them, that has actually been associated with longevity as well.
So pickleball, you're onto something.
Yeah, pickleball. I used to play a lot of ping pong.
Honestly, I love ping pong too.
Yeah. We should start a ping pong club, Longevity Junky Ping Pong Club.
Oh my God, I would love it.
Sleep, of course.
Yes.
Oura Ring, right?
Oura Ring, yes.
Oura Ring should sponsor us, Oura Ring. We mention you so many times, but yeah, I mean, sleep. We've talked about sort of the benefits of sleep and getting rid of the junk during deep sleep. Those potentially sweeping away some of those beta amyloid plaque type things that might build up.
Well, sleep is so important. Getting 8 hours, the most you can. And I do love the Oura Ring, how it tells me how long I actually got to sleep, how long I stayed in bed versus how long I actually slept, as well as how well I slept. But also it's something that people just kind of put to the side. Sleep is so important. It allows so many benefits. And even if we're learning things, it allows us to actually download those things and really learn them.
Yeah, for sure. Yeah. He mentioned labs or you mentioned heredity to a certain extent with regard to Alzheimer's disease. And he didn't get into it specifically, but I thought it was a useful time to kind of talk about for genetic testing in Alzheimer's disease. Probably the most useful test to get is for something called the ApoE allele. So there are basically 3 versions of this. There's an ApoE2, ApoE3, and an ApoE4 normal people, meaning like normal risk, is getting 2 sets of ApoE3, because you're going to get one from your mom, one from your dad, right?
Got it.
So normally ApoE3, that's normal risk. If you ApoE4 actually increases your risk for Alzheimer's disease. And so if you have one ApoE3 and one ApoE4, it increases your risk of Alzheimer's disease by 2 to 3 times. If you have 2 copies of it, it actually increases your risk up to 15 times. Now, ApoE2 actually is sort of the opposite, decreases risk. But the point I'm trying to make is that there is a way to assess risk in terms of Alzheimer's disease. There is, these ApoE allele tests are in every genetic test that you do. And you might wonder, well, why would I want to know? Well, I would want to know because, frankly, I do know what mine is. I'm a wild type ApoE3, so I have normal risk. But if I was an ApoE4, I probably would never have a drink again.
Right. Yeah.
You know,
you would never smoke again.
Yeah. I would look at all life differently, because then it would become about, what's hurting my blood flow to my brain, and I would take it probably 10 times more seriously. So knowing that there is risk mitigation strategies, I think it's worthwhile to consider getting some genetic testing.
Yeah. See, this is why I love having you in my back pocket and having a show with you, because then I actually get these, very specific like tests or any sort of protocol that I should do in order to live longer, live healthier. Like I'm so grateful for you.
Thank you. Thank you.
I'm just so grateful.
I'm really grateful for you too. Community, right?
Yeah.
I mean, that's a big one. And it strikes me, and I don't know what you think about this, Nikki, but I've been thinking about this a lot lately, where the American dream, as we think about it, great big house in the suburbs, all that kind of stuff, is almost the opposite of what humans actually need, right?
Because you don't have the neighbor next door that you can go borrow sugar from, or have,
I live in a 7,000 square foot, jail. Effectively, what I mean by that is that you talk about community. I'm like, people have these ideas of living in these big houses in gated communities and all that kind of stuff. But really, look at your surroundings. You might be in the best possible situation you could be in terms of community. And if you're not, maybe you should stop striving for this thing that might actually make you mentally less healthy. Yeah. Right?
Or at least if you strive for, usually the big house and things like that usually reflect like your income or whatnot. Maybe it's that you, strive for the wealth and the abundance of that, but maybe utilize that money into like experiences or maybe retreats, things where you can actually establish community or be around more people and create more better sustainable memories, for sure.
It makes me think of one more thing, and it's sort of unrelated because we didn't talk about it, but I think it's really important. So one of the independent risk factors for Alzheimer's disease is hearing loss. Now, curious, right? Like, why would hearing loss increase your risk of Alzheimer's? Well, one of the ideas is you're getting less stimulation of your brain, right? So if you have somebody in your life with hearing loss, get them some hearing aids, because what those same studies show is that in those people who have hearing loss, if you put hearing aids on them, their risk goes back to normal. Drives me crazy.
Allows input.
Yeah, allows input. Drives me crazy because my dad's 85 and he's really hard of hearing and he won't listen to me.
I was just going to say, my grandma was not interested in hearing aids, and she would just absolutely like, no, I am not. Like, she was so awesomely vain. Like, it was so cool. Yeah, right. And like, but also just that's exactly it. Right. I think it makes people feel like, oh, I am aging and I can't hear, but it's like, just do it, because it's going to affect you in a way worse way if you don't take on. That's interesting.
So.
Well, yeah, and as like we're saying, like, knowledge is power and having that input, and I think everyone here is probably trying to figure out, how can I go get my brain scanned? And it is about $2,500, I think, for a single, and it sounds like a lot, but honestly, in the long run, I feel like it will save you way more.
Yeah. I mean, I think just getting an idea. I mean, people spend so much money on things they don't need, and at the end of the day, if
your iPhone is like almost $2,000, right? Or something dumb.
Yeah. But like the things that might help you live a healthier, happier life, like maybe one of these SPECT scans or, full body MRI, these types of things are very useful. Maybe they are a little expensive, but if you can figure out how to get it done, it may be the best investment you've done. So
Yeah, very true. I agree.
Well, great show, Nikki. Do you want to read us out?
Sure. Longevity Junky is created by Dr. Buck Joffrey, MD, and Timothy Fornara. It is executive produced by me, Nikki Leigh, Buck Joffrey, and Timothy Fornara. The show is produced by Pretty Fast, original music by Alloy Tracks with mixing by Jay Palezzi, and we're distributed by our friends at Acast. See you next time.
Welcome back. I hope you enjoyed that episode of Longevity Junky with a Y. And again, if you enjoyed it, please go to Longevity Junky with a Y wherever you listen to your podcasts and give us a 5-star review and subscribe to the show. There is a lot of really interesting people coming down the pipeline for that show. And again, I think it's a really, really interesting format. And hopefully you've seen that it's entertaining in addition to just, giving you a lot of information, which often on Sapio, as you know, we tend to be pretty hardcore about our information. This provides a little entertainment value as well. And hopefully you will like it and, share it with other people that you think will find value from it. And by the way, there is an episode 1 as well, and the question answered on that show is, the question that show tries to answer is, has the first person to live to 500 years old already been born?